The changes that we've had and the changes within the station uh, are mostly to ensure that we're safe when we're here at work, and that the people that we generally provide the service to are going to be safe, and that we can do everything we can to make sure it's that way. Our call volume has actually gone down, and that's to be expected. We always see a lot of accidents in the city and outside the city. As well as we help with medical calls, and we help with lift assists and locked door rescues for when people have fallen and can't get up. Well, there's people are at home now and they have help, and they're not leaving their houses in a hurry and forgetting to turn off their burners. So our call volume has gone down, and of course, car accidents. There's so much less traffic that we're seeing a lot less. Well, that was something really cool, and it had been brought to my attention a couple of weeks earlier. And we saw it as, you know what, let's keep this as something that maybe we'll do if this continues for any amount of time. And that's sure enough what happened. Chief Sutcliffe from Laurentian Valley brought it to my attention that he had been thinking about it, but wanted to make sure that he was doing it in conjunction with the Pembroke Fire Department, because the seniors' homes and the hospital are in the city. I said, I think it's good timing, and it came together pretty quickly. I think that the people in the buildings and working in the buildings deserved it immensely, and deserved to have us let them know how important it is what they're doing, because as much as we are as firefighters and police officers, the paramedics and the healthcare workers right now are the ones that are on the front line every minute of every day, and they deserve to know that we're thinking about them, and that we're thinking about what a great job they're doing in that daily basis. The way that started was we had seen that there was a need, and we were contacted. I believe to tell you the truth, I was working from home at the time. I was on a 14-day self-isolation. And what happened was we were contacted about being a drop-off point to help alleviate drop-offs at the hospital. With them asking for that help and for that need, they said, could the fire hall be that? Well, we needed to meet some certain criteria to do it, and that was making sure that people weren't dropping off here and we weren't having the contact here instead of somewhere else. So essentially what we did is we set up a drop-off area at the front of the building where it's covered, and we make a call to the hospital, and they have a volunteer come by and pick it up whenever there's an amount here that they need, and that's working out really well. The Ontario fire ban was put out to ensure that the province, as well as other emergency services that respond to these wildfires and any other fires, have the capabilities to do it. And at this time during COVID, with the amount of people not working and things not being ramped up, they just don't have the capabilities. So the fire ban was put in place for that reason, and it's a really good reason. We have to make sure that there isn't going to be any wildfires, and they always start from a small fire. Some of the things that we are trying to get out to the public about the service that we're providing and the changes that we have done since the outbreak of the pandemic, and some of them are suspending all of our non-essential fire prevention and public education activities. So unless we have to go out for an inspection or have to go out for something public education, that has been suspended. So again, that's a lot less seeing the fire truck driving around town, parked at the schools or at seniors' homes or anywhere else. Another one that we did was we changed we approved changes to the vulnerable occupancies. Their fire drills, that being seniors' homes, care homes and hospitals, that when they do a fire drill, we're hoping that they go ahead and still do their drills, but they do not gather as they normally would. We have a dedicated delivery entrance here at the fire hall, so any deliveries will go there, ensuring that we also have no contact with the delivery or the delivery persons. The building is closed to the public. We've revised some of our responses. A response to a carbon monoxide call generally would have our truck respond in a non-emergency mode with our crew, unless of course we had evidence that there was signs of real carbon monoxide, not just a detector going off. So now we're responding to these with the minimum amount of staff, and maybe with a smaller response to make sure that we don't have very much contact. We're doing the same at the seniors' homes. Our response to a senior home or the hospital would normally be with the full crew, entering into the building to go and investigate what the call or what the alarm is from, where the fire or the possible fire could be. Now on our response, we are responding to the door with one officer, and the officer will ascertain from outside the building whether or not there's a need for us to enter into the building, using the staff inside the building as our important key touching point. And so those are some of the things that we're doing that have changed what we've been doing since the start of the pandemic.